Today's special guest is Dr. Natasha Campbell-McBride. She is the creator of the GAPS Protocol, which stands for Gut And Physiology Syndrome. She holds a degree in medicine and postgraduate degrees in both neurology and human nutrition. In her clinic in Cambridge, England, she specializes in nutrition for children and adults with behavioral and learning disabilities and adults with digestive and immune system disorders. It was a great interview, very eye-opening for me. I hope you enjoy it. So let's jump right in. Thank you, Dr. Natasha, for coming on our program. Our focus now in this podcast series is the psychobiome, and you seem to be, in my recent reading, one of the kind of originators of this almost. And your work has been revised and republished many times. I see your book here, which I've got, Gut and Physiology Syndrome, that was first published in 2010, and this edition here that I'm holding,
2004. It was first published in 2004. It's 20,
oh wow,
it's almost 20 years old. Yeah.
Wow, that's amazing. So probably a good place to start would be for people that don't know what GAPS is, just starting there with a definition and an understanding.
Okay. Well, thank you for inviting me. I'm delighted to be here. And psychobiome. Yes, my first book, Gut and Physiology Syndrome, was written in 2004. Came out in 2004 for the first time. And it focuses on the brain. The concept of GAPS, and GAPS stands for Gut and Physiology Syndrome and Gut and Physiology Syndrome. In the English language, both abbreviate to the same GAPS. And there are two books. Now, there is the yellow one that you've shown, and that's the second edition, and there is a blue one. So that one's about the brain. This one's about the rest of the body. So this is Gut and Physiology. This one came out in 2020. So two years ago. Yes, 3 years ago. So what is GAPS? Human body is a microbial community. That's what our science has come to, finally, to the understanding of that. There are far more microbes in us than there are human cells. There are microbes in your blood, in your heart, in your lungs, in your joints, in your muscles, in your brain, on every mucous membrane, in cavities, everywhere. But the biggest microbial community lives in the digestive system. And the reason for that is because the most powerful influence on any microbial community in nature is food. You change food supply to a microbial community in a petri dish, in a lab, or anywhere else, everything changes within a couple of hours, literally, because microbes produce trillions of babies per hour. They're very fast at that. Certain species disappear, other species proliferate in there, and the whole microbial community changes. Where do we put food in our bodies? Into the digestive system, of course. That is why the majority of our microbes in our bodies live in the digestive system. The Western scientists gave us a figure. They told us that 90% of all cells in the human body are in that gut flora, in that microbial community in the digestive system. I don't know how they've estimated that, but that might change. But at the moment, we're operating with that number. And this is the big ministry, the big headquarters, the heart of that microbial community that your body is. And when we eat, that microbial community changes very rapidly, very quickly. And because it is connected to the rest of the microbial community in your body, it affects everything going on in your body. No matter how far away from your digestive system an organ might be or a system might be, it is greatly affected by what is going on in the gut because your body is a microbial community. So the concept of GAPS was born more than 20 years ago now. Basically, what I've said in that concept, what I've explained to people, that every disease begins in the gut. That is what Hippocrates, the father of modern medicine, came to, that conclusion he came to thousands of years ago. And now with our modern scientific muscle, we are confirming that he was absolutely correct, that every disease begins in the gut. At the time, I was dealing with children with learning disabilities and mental illnesses, people with mental illness and neurological illnesses, because I'm a neurologist by training. And what I've come to the conclusion that I've made, that all of these illnesses, all of these problems stemmed from abnormalities in the gut flora. That this child or this adult has abnormal gut flora. The microbial community in the gut is not properly balanced, not properly harmonized with the body. Certain species of microbes overgrew, proliferated, and they are causing trouble. These microbes, they became pathogenic. They digest food in their own way, converting it into millions of poisonous chemicals. At the same time, they damage the integrity of the gut wall, making it porous and leaky. They turn your gut wall into a sieve, literally holes develop there. So all these millions of toxic chemicals that the food was turned into absorb through that damaged gut wall into your blood, into your lymph, get distributed around the body. And when they get into the brain of the person, they upset the function of the brain. The brain gets poisoned. When this poisoning gets into the brain, the immune system tries to clean the brain. It joins in because the immune system is everywhere in our bodies, and it is its job to protect your body, to guard, to safeguard your body. So the immune system, when they'll launch inflammation in the brain, give it a couple of months, autoimmunity will join in and other tools of the immune system will be used. So the brain gets inflamed and the brain gets poisoned and it cannot function properly. As a result, the person develops a mental illness, mental symptoms. If this happens to a child that is developing a baby or a toddler, a child in the first 3, 4, 5 years of life, when the brain is developing rapidly, that child can develop a learning disability. The most severe situation is autism. From my point of view, from my clinical experience, and I've worked with thousands of autistic children, almost 100% of them were born with a perfectly normal brain. These were perfectly normal babies, but they acquired abnormal gut flora from their parents from day one of their life, from the beginning of their life. And that gut flora poisoned the child, damaged the integrity of the gut wall, produced all those poisonous chemicals, chemicals absorbed, got into the brain, and poisoned the brain of the child. And how do babies learn? Little babies, if you observe them, they use their sensory organs to collect information from the environment. They listen to everything, they look at everybody, they touch everything, they take everything in their mouth. What are they doing? They're using hearing, vision, tactile sensitivity, the sense of smell, the sense of taste, to collect information from their environment. And then that information is passed to the brain processes it, and from that information, the child learns how to be a human being in this world, what to do, what not to do. But if the brain is poisoned, clogged with toxicity, it's unable to process that information appropriately. That information turns into a noise, into a mush in the child's brain, and the child develops autism, or develops ADHD, or dyslexia, dyspraxia, oppositional defiant disorder. The list is long, and our psychiatrists keep creating new diagnostic labels for these children. But the real disease, the real problem is GAPS. Because diagnostic labels are purely descriptive, they only describe the symptoms. But the root cause of the problem is abnormal gut flora and a river of toxicity flowing from the gut to the brain, poisoning the brain of the child, and the child cannot develop properly. If this happens to an adult, the adult develops mental symptoms, mental problems from mild, such as a bit of anxiety maybe, or not very good memory, all the way to schizophrenia or something very serious. When this river of toxicity gets to other organs in the body, wherever it gets to, it causes disease. If it gets into your joints, you can get arthritis. If it gets into your lungs, you can get asthma or another lung disorder. If it gets into your heart, you will get atrial fibrillation or other rhythm abnormalities or something else going on with your heart. If it gets into your nervous system, you will get a neurological disease, such as multiple sclerosis, Parkinson's, amyotrophic lateral sclerosis, Guillain-Barré, various neuropathies. if it gets into your hormonal glands, into your adrenal glands or thyroid gland or pancreas. So when this toxicity gets into our endocrine system, into our glands, it upsets the hormonal balance in the body. Hormones are our masters of our metabolism. They affect every organ, every cell, every function in the body. So when that happens, you get symptoms everywhere, all over your body, quite often disconnected with each other, very difficult for mainstream doctors to make any sense of it. So that is the GAPS person. So any disease, every chronic disease stems from the digestive system, without exception, every one of them. And the treatment has to begin in the digestive system. So the GAPS Nutritional Protocol, that has now been around for more than 20 years, has been specifically designed to normalize the gut flora, rebalance the microbial community in the gut, and heal and seal the gut wall. Stop that river of toxicity coming through the gut wall from the damaged microbial community in there, into the blood, into the lymph, and getting distributed around the body. Can you still hear me?
Yes.
Yeah.
And I have, gosh, 5 questions already that just from that short introduction to GAPS. The first is your comment about the headquarters of this microbial community being in the gut. I wonder, do we know now the communication mechanism between that HQ and the other microbes on the different surfaces elsewhere in the body?
The communication can happen through many ways, and we know this from studying soil. Because the scientists, the biologists that have been studying healthy soils on our planet have accumulated a lot of information about how a microbial community works. Because soils on our planet, the topsoil, is a microbial community. And the basis of every microbial community are fungi. Because fungi grow myceli, long protrusions, hundreds of meters long. And the diameter of that myceli is about 100 times bigger than a bacterium, let's say. So this myceli create a roadwork, a system of motorways, streets, lanes, roads, anywhere in nature. And along that roadwork, bacteria, viruses, other creatures, archaea, other creatures create their own little villages, towns, cities, hamlets. And this roadwork brings them the nutrients, takes away wastes, brings water, and brings information. The information is transferred through that network. So the soil, a healthy soil on our planet, is a microbial community, and it has its own internet. This network of fungal myceli is like a World Wide Web, far more sophisticated than our internet. It was called a fungal blanket that covered the whole planet. It's called mycorrhiza. And every tree, every plant, every grass between those trees are communicating with each other through that internet, through that web. The same thing happens in the human body. Fungi grow through all of your organs, through every barrier in the body. They have no barriers. And they form the basis of the human body that is the microbial community it is. And information is spread through those myceli, through that network, to all the other microbes in the body. That is one way of communicating. There is another way of communicating information in the human body, and that is a quantum way. That happens on a quantum level. There is some limited research in biophysics on that, and that information is spread instantly. The quantum information is spread instantly. So wherever your body is facing some kind of threat from the environment, for example, a virus came into your nose, and lymphoid tissue in your nose has immediately got the information about that virus. And that information is then communicated instantly to the rest of the lymphoid tissue in your body. And lymphoid tissue in the body is everywhere, on every mucous membrane, it's in other organs, in other places, it's everywhere, pretty much. So there are many things for us to discover yet and to study and to research, but we have some information on this. Human body is amazing. Nature
That's
follows.
wonderful. Yeah, the biophysics of it is something dear to my heart. I'd love to learn more about that. Um, you mentioned at the beginning too that the babies that you looked at and researched were born with healthy, intact brains, and it was the sort of the inherited microbiota composition from, I'm assuming, the mother that that is what is changing. You know, with babies that have GAPS, it's what's changing the brain and making it toxic. What percentage of that were you seeing? Was it 100%? Was it 50%, 20%? What percentage was of that microbiota community that was inherited was creating that brain toxicity?
Before I talk about the health of a child in my clinic, I always first talk about the health of the parents, grandparents, and siblings to get the full picture. And having accumulated information about from thousands of families, a typical picture has emerged. The grandparents were born somewhere around the Second World War, maybe just after, or maybe even before the Second World War. And that was a very different time. The whole planet was organic. Just think about that. The whole planet was organic at the time. There were no antibiotics, there were no vaccinations, there were hardly any agricultural chemicals available at the time. So these generations of people got healthy, properly balanced gut flora from their parents, which humanity had forever, practically forever on our planet. Because the mother and the father passed their microbiome to their baby. And the mother passes it during the 9 months of development. Because uterus of the woman, the placenta, have their own microbial community. They have their own flora. Nothing is microbe-free in the human body. Nothing. So as soon as the baby's body starts evolving and developing in the uterus of the mother, it gets populated by a microbial community that lives right there. The father is not exempt as well because he's got his own gut flora, which comes out of his bowel, populates the organs in his groin, and he shares that flora with the mother on a regular basis through sexual contact. So when the baby is ready to be born and the baby goes through the birth canal, it swallows mouthfuls of microbes which live in the birth canal of the mother. And that microbial community comes from both the mother and the father. That's how Mother Nature designed it. That's how both parents are supposed to pass their microbial community to the child. Unfortunately, we live in a world where increasingly we have created an environment which damages microbial communities, particularly the microbial communities in living objects such as human body. So antibiotics, number one, they were invented sometime around the Second World War, and they really came out onto the market in large quantities at the end of 50s, in the 60s. Where people started taking antibiotics, that was a new miracle drug, and they were started taking it for every cough and sneeze, whether they needed it or not. Every course of antibiotic kills a bunch of microbes in your body. No antibiotic in the world can kill all microbes. They only can address a particular specific group. That microbial community in the human being was balanced. It was harmonious. Every microbe is important. Every microbe is there because they all fulfill certain functions and they all control each other. They don't allow any one of them to get out of control and start causing trouble, because every microbe on our planet can cause disease when it's out of control. The only way to live with microbes is to have harmony, to have balance. Antibiotics break that balance. When that bunch of microbes have gone, what's left is out of balance and it overgrows because it's not controlled anymore. And these microbes, which were perfectly benign as part of the harmonious, balanced community, start causing trouble. They start producing things which are poisonous, they start causing inflammation and other problems. So that's how it all began, with antibiotics being prescribed by doctors. But then industrial agriculture appeared on the planet and started using increasing amounts of various agricultural chemicals in production of food. Vast majority, more than 90% of all these agricultural chemicals are antibiotics in their nature. The most harmful one is called glyphosate. That's the herbicide which is a common name is Roundup, that people spray on their poor dandelions on their lawns and in their backyards. That is a broad spectrum antibiotic. When it came first, when it was first patented, it was patented as a broad spectrum antibiotic. Today, industrial agriculture uses it extensively on every crop, and even foods labeled organic in supermarkets contain considerable amounts of glyphosate. So people are eating antibiotics for breakfast, lunch, and dinner from beginning of the 1990s, pretty much. And it's damaging the microbial communities in these people's bodies, first of all in their digestive system, and then everywhere else in the body. So from my point of view, vast majority of people in the Western world in particular, and other industrially developed countries, are GAPsters. They have abnormal gut flora. They have damage in that department. And when your gut flora is abnormal, your gut, instead of being a source of nourishment for you, becomes a major source of toxicity in your body. A river of toxins flows from the gut into the blood, into the lymph, gets distributed around the body and causes disease. What we have with the generations now, if the grandparents maybe had 1 or 2 courses of antibiotics after the war, before they started their family, those antibiotics damaged their gut flora a little bit, slightly. And they passed that slightly damaged gut flora to their children. Then their children grew up in a very different world. They grew up in a world where antibiotics were given to them throughout their childhood and youth for every cough and sneeze, where young ladies were put on a contraceptive pill. So this generation of people had far more damaged gut flora to pass to their children than the generation of their parents. And with every generation, what's happening now, that this damage to the gut flora and damage to the rest of the bodily microbiome in humans is getting deeper and deeper. And that is the epidemic of GAPS, which is underneath all our epidemics in autism, in other learning disabilities in our children, diabetes type 1, rheumatoid arthritis in children, juvenile arthritis, lots of other illnesses in children, and in young adults as well. Because with every generation, the damage to the microbiome in parents is deeper and deeper, and that is what they're passing to their children during 9 months of pregnancy and at birth as well.
Wow. So back to the original question that led to that excellent explanation, which is you see it as 100% that this microbiota that the new generation is getting is causing the damage to the brain. It really just matters. I would imagine it's the level of degradation to that original microbiota that is commensurate with the symptomology of things happening elsewhere in the body.
Absolutely. From my point of view, majority of people are GAPS, particularly in the industrially developed world.
So in terms of sort of rebuilding and restoring this, you were talking about food as being essentially the source point for doing all of this, and in how setting expectations. How much can you expect to restore the microbiota to a healthy population and maintain that through dietary changes and awareness that way?
I have been training certified GAPS practitioners now from 2010. We have GAPS training. It's a big, now it's all online. We have several courses. So I have an army of these certified GAPS practitioners working around the world. So it's not just my clinical experience, it's the experience of all those wonderful health practitioners that are working with me. So what we have accumulated is basically there are no exceptions. Every chronic disease in a child or an adult responds to the GAPS Nutritional Protocol. For some time, I thought maybe cancer should not be included until one of my practitioners proved me wrong. She cured her husband from the worst form of melanoma. Her husband was given a few weeks to live, and that was 14 years ago or something. He's healthy and radiant and enjoying his life this month. So people have recovered from multiple sclerosis, rheumatoid arthritis, various neuropathies, narcolepsy, schizophrenia, autism, every learning disability, Parkinson's disease, every autoimmune illness, from Crohn's disease, from ulcerative colitis, from anything, absolutely anything, any disease. Because indeed, as Hippocrates has stated it, every disease begins in the gut. When we fix the gut, the body restructures, rebalances, restores the harmony in itself. Because good health is harmony. Good health is like a symphony, a magnificent orchestra playing a beautiful, harmonious symphony, where every instrument knows when to play, is properly tuned, and it's a beautiful whole, in that symphony. What is disease? Disease is cacophony. It's chaos. The harmony is gone. The balance is gone. Nature functions on balance, on harmony. It doesn't function on survival of the fittest. That's propaganda. It functions on harmony. Everything's harmonious. That is why nature is so beautiful. And beauty in a human being is good health, shining through your eyes, through your skin, through your thoughts, your words, your actions, through everything. It is harmony. That's what good health is, and that's what beauty is. We live in a world which is very good at destroying harmony and creating chaos. We live in a technocratic world, technocratic society. So when a human being realizes all of this, and when a human being would like to address their health problem from the root cause, they come to us. They come to the GAPS Nutritional Protocol. It is not easy. The core of it is the GAPS diet. The GAPS diet initially started from just one variety. When I wrote my first book in 2004, there was just one diet, GAPS diet. Now we call it the full GAPS diet. Then over the years, I've developed the GAPS introduction diet, which is structured in 6 stages, and it achieves deeper healing because we start with the foods which are the easiest for human beings to digest and are the most healing. And as healing happens in the body, we then introduce, stage by stage, we introduce foods which are a little bit more difficult to digest, a little bit more damaging for a damaged microbial community. So people move through those stages slowly, gradually, to heal, to rebuild themselves, to restore themselves. Then we've got, as we work with different patients, because one size fits all doesn't work in this world. Every human being is unique, and you have to adapt the program to every human being. Other varieties of the diet appeared. So we now have no plant GAPS diet, basically an extreme end of it where we're eating no plants at all. Because what I've learned through my practice and through my experience and through the experience of certified GAPS practitioners around the world, that for a person with a damaged digestive system, the hardest things to digest and to handle are plants. Plants, all kinds of plants, all of them. Grains, nuts, beans, vegetables, fruit, all the plant matter. The easiest things to digest for a human being are animal foods. And that's due to the way the human digestive system has been designed by Mother Nature. The most natural and the easiest things for us to digest are meat, fish, eggs, and dairy. And they also, in their biochemical structure, are the most compatible with our physical structure. It is easy for a human body to convert a piece of meat into our own muscles and bones and heart and tissues, to restore our body if it's damaged and to maintain its physical structure. So the animal foods are the feeding foods for human beings. The plants are not feeding because they're difficult for us to digest. And the more the digestive system is damaged, the more we have to remove plant matter. In the GAPS diet, we already remove all grains, whether they're gluten-free or not, all grains, all starch, which means all potato family, and all processed foods, sugar and anything refined, anything processed. We cook all our meals at home from fresh ingredients. So how I came to the no plant GAPS diet, I had a group of mothers who contacted me. They had babies with a new diagnosis called FPIES, that is food-induced protein enterocolitis syndrome. Basically, these are a few weeks old babies who are exclusively breastfed. They're not receiving anything but mother's milk, and they can't digest it. Vomiting, diarrhea, the child loses weight, the child doesn't grow and doesn't develop. It's a disastrous situation. Doctors test them, they found that the child is allergic to all protein on the planet. So breastfeeding stops at that point, the child is put on a synthetic formula made out of soya, and all sorts of disasters begin, and these children either die or develop profound mental and physical disabilities. So I had this group of mothers who contacted me with this situation. So I understood immediately that these babies had a very damaged digestive system. So we started with the first stage of the introduction diet, which is very, very limited. And even that wasn't gentle enough for these babies. So we had to remove all plant matter. And when we left these babies exclusively on animal foods, meat stock they were consuming raw egg yolks, they were consuming fermented dairy and boiled gelatinous meats. That's all they were consuming, these babies. Diarrhea stopped, vomiting stopped, we started growing, we started developing rosy cheeks and bushy tails. And we now have quite a population of these children who have grown up, and they are teenagers now. They're beautiful, healthy human beings, developing perfectly normally. But it took us quite a few years to manage to get a speck of vegetable into their diet, to introduce any kind of plant matter. So,
is that a necessity? Is it a necessity at some point to graduate someone toward more and more plant matter?
No. What these children, and then that work expanded to children with ulcerative colitis, people with Crohn's disease, other people with serious digestive disorders, and people with very severe mental illnesses. And what I've discovered with all of these people, that human beings can live without eating plants perfectly well. We do not need them. I have now quite a population of people who are living permanently on entirely animal foods. They're thriving. They're healthy, or all their illnesses have disappeared. They're feeling well. They're doing very, very well. They don't need plants. But what I've also discovered in my work, that human beings cannot live without animal foods entirely on plants. Because I have seen so many people who have destroyed their health, their bodies, with veganism and vegetarianism. And that led me to research this area. And I've written another book, which is called Vegetarianism Explained. I think it's a very important book. I deliberately made it small. It's got some nice pictures in it for the young people who usually fall prey to the pro-vegetarian propaganda, which is getting very strong around the world. What it explains, this book, is that the way the human digestive system is designed, it's very different from a digestive system of a cow, or an elephant, or a giraffe, or a deer, or another herbivorous animal. Very, very different. So the building foods for us are animal foods. We cannot live without them. Plants do not feed the human body because the human digestive system cannot digest them. They're indigestible. And on top of that, if you take water out of a human body, about 70% water in our bodies, by weight, by molecular count, 90%. So when you take the water out, what's left is 50-50, thereabouts, protein and fat. The most appropriate proteins and fats for building our proteins and fats, our bones, our muscles, our brain, the rest of our physical structure, only come from meat, fish, eggs, and dairy. Plant proteins and plant fats are inappropriate. They have wrong biochemical composition, biochemical structure to build our physical bodies. So we eat plants to keep ourselves clean. They cleanse us. They give us a few juices, a few vitamins, a few cofactors, but the bulk of what you are made of, your body is made of, the protein and the fat, they are unable to provide us with. But when we look at cleansing, a lot of animal foods are powerful cleansers too, particularly when we consume them raw. So human beings can live without plants perfectly well, but they cannot be vegans. Veganism is not a diet. It's a form of fasting. Fasting is an ancient way of cleansing your body. So there are many people in this world whose bodies are overweight and full of toxins. They could do with a fast. So to do a few weeks of veganism will be helpful for that person. But at a certain point, the body will finish cleansing and it will get hungry. And it will give you a signal. I'm hungry now, feed me. How will it give you that signal? It will give you desire for a bacon, for eggs, for pot of cream, for piece of cheese, for roast chicken, something like that. Problem is that many vegans in our modern world are doing it for emotional reasons, political reasons, religious reasons, other reasons. They don't listen to their body. They override that signal and they force their body to continue cleansing instead of giving it food. And at that point, the body has no choice but to start breaking down less important tissues, such as muscle and bone, to feed more important organs, the brain, the heart, the lungs, the liver, and other vital organs. The person starts losing muscle mass, menstruations stop in women, libido disappears in both sexes, the bone mass is being lost, and the person eventually finishes up with a deep chronic disease. We now have many recovering vegans in the world. They're writing books, they're writing blogs. These people, they're talking about it. It's very difficult to recover from long-term veganism, and it takes a long time for people to recover. So for any young person who wants to consider a plant-based lifestyle, please give them this book. You might save life.
That's amazing. I will definitely be getting that book because I know a lot of people around me who have things inverted in their head around this topic. So I wonder what you make of the so let's go back to looking at the microbiota themselves and what feeds the microbiota. As I understand it, these are fibers from plant matter that provide the substrate for these that we can't digest, that these microbiota will process, and we will make use of their metabolites essentially in their presence, living on the mucus layer. Is that a good explanation of this, or am I missing something?
We live in a world of nutritional misinformation. A lot of it comes from the science. God bless it. The science so far has been studying bacteria in our gut. Bacteria, 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 bacteria. The basis of every microbial community are fungi. And then on their network that they create, live various bacteria and viruses and protozoa and archaea and God knows what else, all sorts of little creatures. All of them are vital and important. And because our science only studied bacteria, and they fed this bacteria with various plant matter-based things such as fiber and starch, they say, well, this is good for this bacteria. And it's only a few species of bacteria that they looked at. You have a huge puzzle with millions of pieces in it. You've got one piece that you know and you've researched. And based on that one piece, you make conclusions about the whole puzzle. So choose scientific. I tell my practitioners all the time when they show me these scientific papers and say, well, the scientists from that university say this and from that university say that. Choose scientific. Science has always been, it can only tell you what it's researched. And it's only the very tip of an iceberg of the real knowledge. So don't try to rely on science. If you want to lose your weight in life, your way in life, follow the science. You'll get lost. So fiber and starch feed equally the good and the bad microbes. If your gut flora is healthy and thriving and balanced and harmonious, wonderful. Then eating fiber and starch will make all those microbes strong and healthy, and they will make you strong and healthy in their turn. But if your gut flora is damaged and dominated by pathogenic species of microbes, fiber and starch will feed those pathogens. They will become stronger and bigger and make you very sick. That is why people with damaged gut flora, damaged microbiome, don't do well with starch and fiber. We have to remove these things practically completely out of their diet in order for them to heal. So don't try to be too scientific.
That's actually quite helpful. What comes to mind are, I have a feeling I know what you're going to say when I tell you this, are some, scientifically studied types of prebiotics, for example, like XOS, which is claimed to feed only bifidobacteria species. Do you have any thoughts on this that are different than what you just explained?
Too scientific. The science, again, is acting upon one little tiny piece in a huge jigsaw puzzle. Even bifidobacteria, when it overgrows, it can cause trouble. Don't interfere. That is why all our problems and all our trouble come from science. Our industrial agriculture is very scientific, destroying our planet, polluting our waters, destroying, just removing biodiversity and doing untold damage to everything. Our oil-based medicine is very scientific, and it is a major cause of disease and death in the world. This is statistics. These are official statistics. This is not some conspiracy theory, So don't be too scientific. That is the important thing to understand. Mother Nature has created the human body. Maybe not Mother Nature, but Mother Nature we are part. The human body is part of Mother Nature. And nature functions on harmony and balance. And the same with the human body. It functions on harmony and balance. And only nature holds the tools for healing us. And human body is programmed to heal itself. It's an amazing creation. It constantly works hard to heal, repair any damage, to rejuvenate itself, to renew itself all the time. All it requires, nature doesn't ask us to do anything complicated, like some scientific powder in a bottle. Not at all. It just asks us to give it tools, natural tools, food. That is the most powerful medicine in the world. Nothing in the world can come close to food and its effect on human health. The most powerful. And the trouble is that in the industrially developed world, in the Western world in particular, many people don't cook. They don't respect food. They eat whatever's available. That is a very neglected area of human life. Food. When you start the GAPS diet, you reconnect with nature, the very nature of your body, with all your senses, and you start loving yourself. You start generating the energy of love. What is Mother Nature? Why nature is so beautiful? A hair on a cat, a scale on a fish, a leaf, every blade, every grass, every little bit in nature is magnificently designed, and it's so functional. It's so sensibly designed, and it's so beautiful at the same time, because nature is solidified energy of love. And many human beings in this world have lost that energy. They can't find it. They're acting upon lots of other energies, but not the energy of love. When a person starts searching for good food and cooking for himself or herself, and loving their body that way, and looking after their body that way, you are starting operating with the energy of love. And only that energy can bring harmony and balance. Health is harmony and balance.
Thank you, Dr. Natasha, so much for writing these books, for exploring this and developing this method for everyone. And thanks for coming on the program.
That's a pleasure. Thank you for your work.